Hello, everyone. Good afternoon. Thank you for being here. Um, Unfortunately, we have had another death related to COVID-19 in the community. A male in his 50s did have underlying health issues. This is our 22nd victim in our community due to this virus. Our thoughts and prayers are with this man and his family, and we're grieving for all of our victims. Again, a reminder that this is a virus that is not like anything we've seen when it comes to how it attacks and how vicious it is. So even though we'll talk about data today, and behind every data point, we're talking about people and human beings and human life, and there's no cost on human life. And even though our numbers are getting better, this virus is still a serious threat and something we're going to have to learn how to live with. So when we break down the 22 individuals that we've lost, 19 are Caucasian, 2 are of another race, and 1 has been African American, 12 females and 10 males. When we look at our current cases today, we have 667 cases. That's up from 646 yesterday. That's 21 new cases today. Out of the 21 new cases, now we're starting to get into an area, and we'll get more into the testing strategy, but we're starting to play offense with this virus. We're hunting this virus now. So out of our 21 new cases, we have 2 results with our proactive testing strategy and 7 that are contacts. So why is this important out of the 21? That 21 is a little misrepresentative of what is the community spread right now, at least for this day. We essentially have 12 cases where they're community spread. We had 2 where we're proactively searching in areas where there's density. And then there was 7 contacts. We know if we have contacts or households, those are easier. Our health department already has these individuals in quarantine, so contact cases don't take as much and drain us of our resources the way new cases do. But looking at hospitalizations, we have 44 individuals in the hospital, representing 16% of our active cases. This percentage has gone down. It was been 18 to 20. Now it's been around 16 for each of the last few days. That's positive. We have 16 individuals in critical condition. This is representing 6% of our active cases. This has gone down as well. So this is better news when it comes to our hospitalizations, the percentage of individuals that are going into the ICU. These are trends that are going in the right direction for us. Our medical infrastructure is sound, and we're able to meet the challenge. Further details on the 44 who are hospitalized: 23 Caucasian, 12 African American, 3 of another race, and 6, we just don't have the data on these individuals yet, so the demographics are unknown at this time. Today there are 369 individuals who have recovered. That's up 7. So if you look at our curve, that's the green curve. We've always said that curve needs to go north of the active curve, which is the yellow curve, and it has. We're presently monitoring 276 active cases. That's our yellow curve. That's up 13 cases from yesterday. Certainly, many of those cases were actually contacts now, and so that's not new strain on our infrastructure. We've been monitoring those contacts because they've been in quarantine already. 89 contacts now. Again, that's up 7 from yesterday. These are individuals who are households of previously confirmed cases. We now have 859 people in isolation or quarantine. This number's down again from yesterday. Big drop in this number. People are getting better. People are going through their quarantine process, and they're not getting sick. This is important at moving forward. This number is an important number in our process related to our medical infrastructure. Remember, in any restart, whenever that begins, we need to be live tracking, attacking this virus throughout the community. We need resources going to that. Certainly with the quarantine numbers going in the right direction, this is very positive as well. Breakdown, 363 of our cases have been female, 304 have been male, 21 are under 19, 126 in their 20s, 97 in their 30s, 110 in their 40s, 122 in their 50s, 95 in their 60s, 49 in their 70s, 33 in their 80s, and 14 individuals in their 90s. Breakdown by percentage, 22% are under 30, 37% are under 40, 53% are under 50, 71% are under 60, and 29% are over 60. Breakdown by municipality, 287 City of Syracuse, 72 Town of Clay, 46 Town of Manlius, 37 Town of Salina, 36 Town of DeWitt, 33 Camillus, 33 Onondaga, 26 Cicero, 21 Geddes, 20 Pompey, 19 Lysander, 14 Skaneateles, 4 Marcellus, 4 Atisco, 4 Van Buren, 3 Lafayette, 2 Elbridge, 2 Fabius, 2 Spafford, and 2 Tully. So far, there have been 8,755 tests administered. We had 348 tests completed yesterday as we had a massive testing day in our proactive testing strategy. Very busy day for us as we started really hunting down this virus. In the last 2 days since we started this, we've done, well, we do that. We've had 8,541 tests that have been returned with 646 positive and 7,895 negatives. When it comes to testing right now, we have almost tested 2% of our county's population, which doesn't seem like a lot, but that's far greater than what other communities have done. And by this time next week, we're pretty confident we'll be closer to 3% as we're proactively identifying areas where this virus can do the most harm to our most vulnerable citizens. We currently have 214 pending tests. Certainly this number is going to go up because we're out there being proactive. We received 255 tests back yesterday. Right now the percentages are holding pretty true. Around 7.8% of our tests come back positive with COVID-19. Reminder, our nursing home teams and our assisted living residents and assisted living teams have been very receptive to this proactive testing. We have strategic areas and testing partners that are doing strategic things. We're moving into independent living communities and senior apartments by the end of the week. So we'll continue this proactive hunt of COVID-19 in our vulnerable populations. Moving forward, we're going to continue to look at areas and look at the data as we get to assess it for any trends that we've seen, any vulnerabilities that we've seen, and we will proactively test those communities to try to get ahead of anything. This is critical as we look at restarts, that we're really going through, diving in, being proactive where we can as the inevitable restart happens in our community. Again, after the positive test result, our health department's going to contact you, check in on your health, check in on symptoms. You should also hear from your doctor. In addition to that, that's when we begin our investigation into direct contacts that you may or may not have had. From that investigation, we go to the direct contacts, we determine quarantines, and that's how we box in the virus and stop the spread to the rest of the community. A reminder, just because you work at the same employer as a positive patient doesn't mean you had direct contact. If there's ever any gaps in our investigation, we'll let the public know about those gaps and ask the public for their help. Social distancing, give you a little bit of data related to social distancing since we did our voluntary shelter in place. It's 2 weeks. 2 weeks is up that we asked the community to rally. Reminder, there's already social distancing requirements from the federal and state levels before our effort, our initiative. But because of you, you've helped us with our curve, residents of the county, residents of the region. On May 29th, we had our most active day with COVID. We had 48 cases that day. That was before our voluntary shelter in place. During our 2-week test, the high number for cases was 26. We brought that number down in a very short period of time. The 2 weeks prior to our shelter in place, we're averaging 23 cases a day. If we had continued on this average, we would have had 722 cases today rather than 667. So the shelter in place is brought down the potential exposure to go higher, but certainly we can attribute at least 60 to 65 cases to the voluntary shelter in place that did not happen. And from that, you have contacts. From that, you have quarantines. If we can't get to you quickly enough, you may have more contacts outside of your household, and the spread could be that much worse. So just by going by averages, we knocked it down by 4 cases a day because of your efforts in the community. Thank you. These are the efforts that we need to have the data and our health department ready to respond to any sort of restart. So we're moving in the right direction. So related to the question that I've been getting about, do we extend the shelter in place? I don't see that being necessary at this time. But what I am asking you to do is I'm asking you to continue to do more than you did last week with staying at home. So remember, a shelter in place was saying, if you're born this year, please use the grocery stores, the parks on a certain day, and if you're born on the next year, do the same thing on different days. We don't deem that to be necessary, but what we do deem to be necessary is that we stay the course and we continue to social distance more than we did last week. And by doing more, our data will be at a point next week that we will have a nice case to make to the public and to our partners that we have done something different in Central New York. We've stayed ahead of this curve, this process, and our community has not been impacted the way others have. And that's what we've been saying. Let's write our own story in this process, and I think we're getting close to doing that. So thank you for that to all the residents. When we look at the chart here, this is the Central New York regional chart we've been watching. We've been watching our new cases. We see the curve pretty flat. Green cases recovery. We see that moving up in the right direction. Active cases, pretty flat. This is good data for the region. We'll continue to track the regional data as well as our local data because we're all connected. And if there's spikes in other counties around us, that could lead to new cases in our county. So we need to work together, and that's what we're doing. We've had a couple calls now with our county leaders related to restart planning. The calls have gone well. Everybody is working very well together. Our health departments are going to be talking to each other. We're working through important metrics that trigger a restart, and then the how and the who, what that looks like in that restart plan is different. That's being driven by our ability to track this virus and fight this virus in real time. So those are important things. There's the how and the who of the restart plan, and then there is the when. And the when is triggered on data and input from our public health departments. And the how and the who is being worked through in consultation with our health department and certainly with input from other government leaders and the business community at large. So those calls are going well. We're very, very encouraged by the governor's comments today related to this. We're very encouraged by the governor allowing elective surgeries again for regions, loosening up those regulations. We want to thank the governor for doing that, recognizing that we are regions, we have regional economies. So we're very encouraged by those things today with our partners in state government. Again, just as we plan for the virus, we plan for a restart. That's our job. And some people are concerned about going too fast. Some people are saying we're going too slow. We'll find the right balance. We'll find the right balance so that we don't have a new a new curve right after you have a restart. You have to put in the proper protocols and procedures to avoid that from happening. But certainly we're very, very encouraged by some of the things we're seeing related to healthcare capacity, related to our cases slowing down, our quarantines going in the right direction. All these numbers are promising. Critical information still here that we want the public to know these numbers. Our Upstate Triage Hotline, 315-464-3979. You call this line if you don't have insurance, you have symptoms, you're concerned you may have COVID-19, you'll get screened, you'll go to the Triage testing site at the Syracuse Community Health Center. Our seniors, healthcare workers, and adult nutrition hotline. Again, this was a gap in services that we knew we were going to have when we're asking people to stay home, and people who are had medical conditions before. We know this virus can be tough, so we need to fill that gap. We filled that gap with some of our employees and with many of our volunteers. This could be meals, this could be groceries, toiletries. That number is 315-218-1987. Part of this process has always been childcare. It will continue to be part of this process through our great network with Childcare Solutions, 315-446-1220. We have identified daycare slots while preserving slots for parents that had slots at the same time. Very complicated stuff, but we've been able to do it. We have these slots available to essential workers, and certainly as we start a restart at some point, this will continue to be a key component of our plan. We want to thank our great partners at Childcare Solutions. And we can't say it enough, but 211 for emotional, social support. This is really unprecedented what we're going through together. We are going through this together. We're having good days and we're having bad days. But if you need help, call 211. They can either help you or help refer you. Mental health is no joke, and we need everybody to get the help and support they need. Questions?
Can you just confirm that you were talking about the elective surgeries? Are they going to be allowing those in Onondaga County?
Yeah, we've deemed that elective surgeries based off of the guidance is allowed in Onondaga County.
And that's outpatient only?
Correct. Correct.
So starting tomorrow?
Starting tomorrow.
And
Yep.
that guidance from the governor indicates hospital capacity is over 25% for the county, and if there have been fewer than 10 new hospitalizations over the past 10 days, is that the same criteria you're aware of?
That's what we're looking at. April 18th is our date. We look at there, and then, or actually it's not April 18th, a little bit further back. But when we look at the numbers, we're dead on with hospitalization numbers from the previous 10 days. So our hospital capacity is not a challenge. We've been saying, if it was, I wouldn't have been saying for the last 5 days, let's get this going. It's not a challenge. Our percentages of active cases are going down. Our ICU percentages are starting to go down. It doesn't diminish the threat that this virus is, but when you look at public health overall, we're inundated with COVID-19 because it's the immediate threat. It's a pandemic unseen before, but these elective surgeries deal with public health as well. Having people who are sick on the sidelines for a week or two is one thing, but going into 2-3 months can lead to very, very serious things. So we're very happy that the governor loosened up these regulations, recognizing he listened to us. I'm very happy with that.
Does that include all 3 hospitals, 4 if you count community?
I believe community is part of Upstate,
Right.
But all hospitals are allowed to do electives at this point.
How about non-hospitals?
I'd have to look more at the guidance there, Andrew. If I don't know if your orthopedic surgeons or whatnot qualify. It seems like they would, but I would have to look more at the guidance there.
Thank you.
The questions?
The testing numbers that you gave us, and I think you said there were 348 new ones sent yesterday. Those include the proactive testing going out into senior living facilities. Do they also include Walmart?
They do not include Walmart. We haven't received those results yet. These are numbers that essentially we went into assisted living facilities with employees and the residents, and that's how busy we were. So Walmart's numbers will continue to come in. We expect those numbers to probably hit tomorrow, and certainly it will be interesting. Proactive, you're hunting, right? And certainly at the Walmart site, you have some folks that still have the ability to use the CDC guidelines to get tested, and you'll probably see the percentages fall in line. 7.5% to 8% of those will be positive, but these proactive measures, it's going to be interesting. We're essentially hunting down as a risk mitigation strategy to people that have little ability to social distance in a great way. So that's why we're doing it. I don't want to say we're excited for the data, but I think we kind of are. So we want to see what the data looks like. For the first time, we'll probably be able to see what kind of asymptomatic cases we may have, and we know that we're eliminating risk to our vulnerable populations by doing this. So we're happy that we're in this phase of this process.
Do you have a precise number for how many of those have been done, the proactive ones?
I believe yesterday, Tim, we had 350. I believe the majority of those were actually related to our proactive assisted living testing with Essentia Health.
Either at facilities or at the
Correct.
community health center.
Correct. The demand in the hospitals for COVID testing has been down. At the triage site, there was a little bit of a pickup after Easter, and then that's been down. But now we're pushing others to. There was independent living facilities that we were pushing to the triage site, and we know we got some results back from that. So overall, we're at a new phase where the community spread of this virus is slowed down because of the efforts of the community and some of the policies that have been put in place, and our health department's ability to be really, really active on top of this 24/7. Our medical infrastructure is helping getting people better, but what we're now really fishing for potential community spread and capturing it before the infections take place. So we're excited to be proactive. We feel good about taking this fight directly to the virus to save lives.
Kind of jumping off that, we were in contact with the family of a man who died at the Central Park Rehab and Nursing Home last night. So, besides this testing, what else are you guys doing to kind of focus in on that nursing home in particular?
Well, we don't have regulatory authority over the nursing home. What we have done is we have been partnering with the state's regional office on nursing homes. We've been helping with contact investigations there. We've really been pushing employees there to get tested, and so that's happening. The employees at these nursing homes, you talked about that's one of our larger nursing homes. So this is all risk mitigation, right? So you have an asymptomatic employee goes in, they're doing their job, they're taking care of people, they're asymptomatic, they don't realize it, they spread it. That individual then may spread it to someone else, or they may spread it to multiple people. So we're trying to identify the risk, quarantine the risk, and then certainly working very, very hard to treat these individuals that have COVID to make sure that they get better and recover.
Do you know how many of the 22 deaths were associated with either a nursing home or assisted living facility?
Yeah, I'm not exactly sure, Andrew. I believe the number, I believe that the state regulation says if there's a facility that has more than 5, they give you the facility name. There's not been any that have more than 5. So I think our overall, it's difficult. That's a difficult number to track because they haven't figured out the definitions yet. Somebody that lived in a nursing home but then went to the hospital because they're critical and died in the hospital. Is that nursing home? How do you track that? I think our answer on this earlier this week was until they give us clarity, the state, we don't want to be singing from a different set of music than the state related to these definitions, specifically because it's not under our regulatory authority. That's tough to say. We've had deaths, certainly, of people that have lived in nursing homes. What that number is, I don't know, but I want to make sure that definition that we're using is the same that the state's using.
Do you know about this latest death?
The man in his 50s, he had significant underlying medical conditions. I believe he may have been at one point living in a nursing home. Yeah.
Have the hospital leaders told you, you mentioned a phased-in approach, so is allowing outpatient elective surgeries just one step in full-blown elective surgeries and then beyond from there?
Yeah, I think you phase everything in. And so you having elective surgeries, then going back and putting people in nursing homes for rehab doesn't make sense. We can't do that, right? We know nursing homes are a target of COVID-19 because of the density. So that's if an elective surgery is going to lead to that outcome, we can't have it. So I think the governor is very wise with what he did today. We need to get these people off the sidelines. We need to get people who are injured healthy for the overall public health. We've said there's regulations with other essential businesses that we feel can probably be loosened. And then that's different from a restart phase one, right? Restart phase one, you're looking at allowing businesses to operate that can implement social distancing, and so that it's not bringing more risk into the marketplace than's already there. And then we're able to regulate that, and we're able to have our team tracking this in live time. The data is getting closer to where our health department will be able to do that. Certainly two different things, but very related.
This is just one piece. It's not like the hospitals will all of a sudden have full beds and can't help COVID patients if they come in. This is a very small piece of business for the hospitals that's now being restarted.
Correct. The capacity is not an issue. So, and the hospitals know they need to keep certain percentage of those beds open for COVID patients, or else they're going to have serious infectious control problems within their own buildings. But certainly we're working every day. Our emergency management is on calls related to this topic, and we've been working in coordination with them on lobbying for this based off of, it's all about risk mitigation. So right now, overall public health, there's a lot of different factors into overall public health. This is the one we're all talking about. We're concerned about opioids. We're concerned about suicide. We're concerned about people who haven't been getting the medical attentions they need. So there's all these things, too, that we have to start addressing. And to address all this, we need to find that balance. And certainly that's what we strive to do every day, is find that balance between the public health and the economic recovery.
Can you kind of talk about what events that you're aware of that are being canceled? Like, for example, Taste of Syracuse, and have any of those community groups that put on those events kind of reached out to you about how they can still put them on with, practicing social distancing and all that? Yeah,
I think larger events in the short term are going to be harder to host than some potential events down the road. And this is a moment in time. So today, could there be festivals in June? Maybe. Could there be concerts in June? Yeah, maybe. That depends on what we do today and how we're able to implement a potential restart and continue to social distance to starve this virus. So if you had a large event in the first week of May, probably not going to happen. But certainly part of this and part of a restart phased-in approach is you have to test this virus at some point and see how it reacts and see how you react with your plans and preparation. And so at some point, you're looking at businesses that can easily operate under the social distancing requirements. And then at some point, people got to go to church, and people got to go and be able to sit in a restaurant, and people got to have meetings again. And this is, you do it gradually, but this is the reality. And we're going to learn with each other each step of this process.
Have you seen the Republican Assembly members' regional restart plan? What do you think of that? I've
not seen it. They did not call me and ask for my opinion on it. That's too bad, because we've been working really hard at this. I think the idea of a regional restart plan is smart. So I've not read their plan. I think you heard the governor today recognize regions are the way to do this, and having a regional restart plan is smart. we're working on that right now. The leaders in the counties working on it are bipartisan. There's Republicans and there's Democrats working together, and we're the ones with the health departments. We're the ones that don't get to sleep at all. So we'd be happy to share any of our real life experience with any group looking at their own plans. But certainly, I think the idea that they have their own, they want to get things moving regionally is good. But again, you have the plan, the what, and the how. The when is the important part of this as well. And we're kind of the ones who know the when, because we're in charge of public health in our own communities.
With the voluntary stay-at-home order being lifted and the alternate shopping days being lifted, just to confirm, moving forward, starting today, people don't have to follow that. But also going along that, the numbers did go down. So is there a concern that they could go back up to where they were now that we're getting rid of the voluntary?
If people don't social distance, the numbers will go up. And what that will do is that will make it harder for us to restart on our own timeline. So if you're of the opinion that we should have already opened up the economy, you need to stay home for the next week more than you did last week. That's how we do this together, right? If you're of the opinion that things are moving too fast, even though nothing's changed, then continue to social distance, because we'll get the numbers to the point where everybody who doesn't agree today on how to move forward will come closer together in their opinions, because the numbers will tell the story. And we know every day what our ability is to respond to this virus and our capacity. And that's my team, that's Dr. Gupta's team, that's talking to Tony Pacenti in Oneida County and all of our partners in Cayuga County and Madison. We know that. It's hard for the public to understand that, because you're not with me all day long. You're not shadowing me. But as we do more together with social distancing, the numbers will get to the point where the debate about restart or no restart will start to fade away a little bit. The numbers will tell the story. This week, I think we're in week 6 of this virus. And it's early in week 6, but right now our average so far per day is 15 cases. Out of that 15 cases, 4 of them a day are contacts, okay? So those are cases that we don't do any more work because they're already quarantined in a house, and we already anticipated those. So you really have, on average, 11 so far this week, 11 cases a day of what is reflective of community spread. That's down from 22, 23 a couple weeks ago. So that number, those numbers could change. They could go up if we don't stick with it, or they can go down. And as we starve out the virus goes away in that area. So those numbers may go up a little bit as we're playing offense, but we're going to look at those affiliated cases in our proactive testing differently than we look at the random community spread samples.
You've mentioned the governor's date, end of April, the president's date, also end of April. Why not just extend the voluntary shelter in place to the end of April?
Because, look, it brings confusion, it brings some anxiety when the government's telling you what day you can go out, what day you aren't. So we did that to get the community to rally, to get them focused on this. We started seeing data slipping away a little bit. That we're refocused as a community. We know what we got to do. We're responding. We're not saying go back out there and break social distancing laws. What we're saying now is actually do more than you did. Just do it when it makes sense for you. That's what we're saying.
Ryan, in talking about the regional approach to restarting the economy, the governor made a specific point of saying that Kathy Hochul will represent him in Western New York and Bob Duffy in the Finger Lakes. Has he named someone who's leading up as a liaison in Central New York?
So we've been in contact with the governor's office on a daily basis. They're very well aware of our meetings and how we're going to put a plan in front of them. When it comes to the Finger Lakes and Erie and the Western New York, they're not quite where we are with their process because they're still in a little bit of a dogfight. And we're we're rooting for them in Monroe and all the Finger Lakes counties, and certainly we helped out Steuben County in the Finger Lakes not too long ago with test kits, and an area a little bit more of a serious situation. So the way where we are, Tim, is that Ryan McMahon, the county executive from the largest county in Central, is taking the lead, and Tony Pacenti, the largest county and the county executive from Mohawk, which borders Central, is taking the lead. If the governor wants to give us a point person to work with, fantastic. But we've been in this fight. We've been leading this fight for Central. I got great partners and the chairs in Oswego and Cortland and Cayuga and Madison. But we're going to have a document for the state to consider in short order, and we are coordinated within our counties, not just with the elected leaders, but with our health commissioners, our emergency management, our purchasing. We are ready to work together on this pandemic, on what the next step of this is, but we will work together more than we ever have before going forward.
Can you
Sort
give-
of an ancillary question to that. You've talked about the need to hire more people and to build a small army of tracers. Do you have just any better projection on how many people you need doing that?
Yeah, Dr. Gupta and I were talking to Ann Rooney, who's with us today, my deputy county executive, about this today, and we're looking at it. We're looking at this potentially as a shared service too, with some of the other counties around us. So we hope to have more details on that by the end of the week, and it's going to be a team that's going to have a regulatory component to it, certainly a investigative component, a medical and public health and data component to it.
Can you give us more details about what came out of your call with those Central New York leaders today?
Well, the collaboration is really fantastic, and we're going to work with our cities now on what we've been discussing and get our cities' input. Oswego, as the city of Oswego, Mayor Walsh and I talk every day. We've been in lockstep with what needs to happen, but we'll continue to brief each other on everything. Cayuga is going to work with Auburn. You're going to see Oneida working with Utica, Rome. So, and we're talking to the various key private sector companies in each county, briefing them, getting their feedback on this. We've been talking through our Economic Resiliency Task Force here in Onondaga County with the mayor and Center State and McNee and Regional Council with Jim Fail. So these conversations have already been happening here, but we're encouraging some of our other counties to start driving those so that there's widespread support for what we're talking about. And we'll get together again on Thursday and Friday, and hopefully we'll have something for the governor's team to consider about the plan. The when is really, once everybody can agree on what the plan looks like, it's the when. And that's certainly, we think the when, what metrics do you use? We think we've met some of those metrics. We think we still got to do a couple things to meet some of the other metrics. Certainly testing, we think we're close, if not there. Our ability to do rapid testing, our ability to test with various triage sites. Capacity in the medical institutions is there. Downward trending cases, we're there. We want to see it happen a little bit longer. Our PPE, a little bit better. Want it to get stronger. And contact tracing, we got to put together this COVID tracking team. So these couple things are going to take a little bit more time, but we're working hard to get them there. And if the data continues to move, we continue to social distance, that triggers earlier once the state's comfortable with our restart plan.
Has the state been receptive to your conversations with them about you organizing your own regional plan that will be submitted to them for reopening?
Look, the state's been a great partner. I was elected, so I was elected to do this. Nobody's going to tell me that you can't do your job in this process. So we county executives are very much like the governor. We're reflections of state government. We do the exact same things. So we run the public health. We run emergency management. So that's what we're doing. We're continuing to do. We understand that this is unique, uncharted territory. The state has been a tremendous partner, and we believe that we've been a very good partner as well. And I don't think there's going to be any agita with anything we're doing. The Central New York success story with the fight for COVID-19 is real, and we think we're in a better position this week than we were the week before, which we were stronger than the week before. So things are going in the right direction. We're planning for what a restart looks like. That plan we need the state to be comfortable with, and then the when, we need our health departments and our doctors to be comfortable with.
But if they said, go ahead, send us a plan, and we'll let you know what we think of it?
Oh, we've been saying for well over a week, Andrew. We are coming up with a restart plan. That's our job. Nobody but us can come up with a restart plan because we're the one who has to ensure public health. So no other government could do this except for the counties. And so the governor made it very clear he doesn't want 57 restart plans. So there's the regional council model. We've basically followed that model with Central and Mohawk Valley. We're very connected. And who has to come up with this? The people who are going to be in charge of dealing with COVID-19 have to be the ones determining the restart plan, and that's the counties.
Can you kind of tell us what the DPW crews have been up to? Because I would imagine there probably isn't a better time than now to go and fix potholes and things, but are they also limited because of the coronavirus with what they can do too?
So what we have is our DOT department. So that's paving roads, fixing roads, and plowing roads. We don't do trash collection like the city does, but certainly we're bringing back 20 employees, essentially 5 people per garage, that have been at home to start with our road preparation plans, as we're going to have a road and infrastructure plan still this year. So we're bringing back some folks to get going on that. A lot of our DOT team has been helping us with our continuity of food operations, our senior health care line. A lot of people in county government have been doing different things than what they normally do.
Ryan, does the variation in the case rate within the city of Syracuse, would you say that is mostly the result of affiliated cases at certain, or is it the density of housing?
Yeah. Yeah, we have affiliated. If they kept their customers on campus, we would not have 600 cases right now. We would have hundreds of more cases. So they sacrificed for the greater good of this community related to that business decision, which they knew was going to hurt them. Just like when we started canceling conventions in this building, that hurts our bottom line. We did it because the public health was important. So there's a couple different angles on that argument. Anything else? All right, I want to give a shout out to one of our silent partners. Certainly, we talk a lot about testing, how important it is. I know all of you knew this week, of course. Trish especially knew this. This was National Laboratory Professionals Week. We would not have a shot at COVID-19 if we didn't have our professionals at the labs turning around related to testing. So I want to thank all these workers behind the scenes. You've received absolutely zero fanfare today, to date, but I'm giving you a big shout out today. Thank you so much for what you do. We are really fighting back against this virus right now. We're on offense right now. As hard as it is when we realize the impacts of this virus, we get punched, but we're punching back, and we need to continue to stay together and hunker down. So let's be smart, stay strong, and be safe.